Elder Ashram is the name of the placement site and the community. It's an elder community, as the name already implies a little bit. And my name is Nara Shabahangi, and I'm the clinical director here. And I give it over to Celeste.
Sorry. Okay. My name is Celeste Cruz. I am at the Elder Ashram as an intern, and I'm in, you didn't ask, but I'm going to be starting my final semester at CIS in the somatics program.
So the site, as I mentioned, is a community for elders. We on average have around 75 to 80 elders who are ranging in ages from, we actually have some that are younger. So one could say from 50 to 100. We have a few that are above 100, but normally most of them are probably in their 70s and 80s. Some people are in their 90s. Having different levels of either medical conditions or almost all have some form of mental health condition in a sense of forgetfulness, what we call forgetfulness, and or what is biomedically often called dementia or Alzheimer's, Lewy body or vascular dementia and so forth, various dementias. And already the philosophy is, by calling it forgetfulness, implying that we want to approach this humanistically from an existential humanistic point of view or process work point of view. So process work as a modality of working also does not pathologize. So our basic conception is there's absolutely nothing wrong with you. And when you, whether you're 70, 80, 90, 100, and you forget or don't forget, this is just who you are, and we're going to work with who you are. And we have found in our experience in working with elders, which we have done now for some 25 years, that there's some amazing advantages to forgetting. Like, you know, you can forget your trauma, you forget all kinds of things that often don't seem so very important. So there's a deep appreciation that he or she appears. So that's really the philosophy. The vision would be to have Elder Ashram be a model for elder care, because we really want to emphasize that lifelong learning is really happening at any age, and there's still lots to understand and grow into when you get older, and especially older, and when you do your what some people call a life review, or you have time to deeply connect with your own inner self or an outer self. So there are all these beautiful experiences still to be had in your life as you age. So it's also a different conception of aging. So rather than looking at aging as decline, we look at aging as this amazing opportunity to deepen who you are.
Going in and talking to the elders. And then beyond that, I have case notes, and there's trainings to attend, and also reading outside, like continuing education that either Dr. Notter sends or I do on my own. And then obviously meeting with Dr. Notter on a regular basis to discuss, as well as the other trainees, to discuss the elders that we're all working with. And in addition to that, I would say it's pretty dynamic, and because it is an in-house safe facility, or the ashram, we are also working with care staff, and we're working with nurses, and we're working with the directors. So I would say that there is actually a lot that goes into it beyond sitting and spending time with the elders. One other thing I would add is that oftentimes there's individual work, but also there's group work. So oftentimes I'll be sitting with not just one, but a few elders. And so that makes the work pretty dynamic as well.
And you have also done some nice family work and couples work. Right? Mhm.
Yeah.
Right.
In addition to that, some of the elders are in couples. So there's that. And then also just like sort of interpersonal relations between them. But then there's also family work that has been included. So I'm doing outreach with some of the elders' families and setting up times to meet, and then also being present for those meetings. So yeah, there's a lot going on at the Elder Ashram.
Yeah. Yeah, and as you can probably imagine, Juliet, there are some of us human beings that have some sometimes unfinished issues with parents. And I mean, it happens rarely, but sometimes when they do happen, they still get worked on and worked through at the latter stages of life. So working with the children and their mom or dad, for example, is also a big part that is needed. And COVID has been not that easy and has made things a little bit complicated sometimes. So, but normally we would even more have even more input from with families and the elders living here. So assessment and referrals, that's happening mostly with the people working here. So they're more on staff. The assessment is more in terms of mental health assessment when we work together as a team, that we would discuss the case or the person, so to speak, from a humanistic point of view, likes, dislikes, anything unusual that we notice, what should be paid more attention to. So that's where the in-house clinical team is very helpful with the other nursing and care partner staff and the other directors. So their input is really very valuable in terms of providing a good holistic care for the elders. And referrals, we do have a special psychiatric program where we are a step down, a residential crisis center for some of the psychiatric hospitals. So people come to us after a psychiatric stay for 2, 3 weeks, 4 weeks sometimes, and they stabilize here. And there it is really important to work together on discharge planning. Where would they go? Are they ready to go back home, or should they be more in a care setting? So that's again where interns are very helpful, and because they do often spend a lot of time with the elders and the step down psychiatric cases.
I would say Dr. Notter was so just kind and accommodating, especially when I first started, and that he didn't necessarily assign me people. He wanted me to spend the first couple of weeks just spending time there and getting to know who I naturally gravitated towards. And then it started, there was a little shift. We started to become more structured, and then I was given a large caseload. And then I said, whoa, that's too much. So I feel like I've really sort of experienced a lot there. Now I've stabilized around 5 to 10 clients that I'm seeing on a regular basis. However, it's open so that I could take on more, or if I needed to back off, they're so like I said, accommodating and really into supporting us interns or supporting me and what I need. So just communicating how much I can handle and what I'm willing to do. And I feel like if I wanted more, I would be given more. If I wanted less, I would be given less. And so I'm really grateful. That's one of the greatest gifts, I think, of being placed at the Elder Ashram in regards to like, just supportive like my life and outside of there, and then also my education while being in there.
Yeah, I think and often it also depends a little bit on how many interns do we have. We can have up to 6 to 8 interns. And if we have more, then the client load can just naturally be less for each intern. Or if we have sometimes, the feeling in the community is quite calm, and then we can just touch and feel a little bit more with elders. and sometimes there are, some people need more attention, and then more focus is put on that person, and might need more client hours at that point. So it's a
Right.
dynamic community of people. And you could even say maybe just, so besides the 75 to 80 elders, we have probably a staff that's here at all times of around 20 to 25. So it's a community of 100 people on a couple acres of land here in Oakland.
Right. And if I could add another thing, it's not like traditional where I'm sitting down in a room for 50 minutes and talking to someone, again, because a lot of the elders do have dementia and forgetfulness. Oftentimes it's this milieu setting where we sit in, I go in and I'll sit with someone for 5 minutes, and then I'll move on to someone else for 10 minutes. And then all of a sudden I have a group of people for 30 minutes. And then, so it's really just sort of working with what is there and what is present. And so at any time, I can spend 3 hours there and see a multitude of people, or I could spend 3 hours there and only see 1 to 2 people. It's really just like what's being asked for. And so being present for that, I think. And so there's been times that some elders really need and are desiring additional time and attention. And then there's times where it seems just everyone's doing their own thing, and it's more of a jovial event. And so it's really just going in and having a good time, which almost sounds weird to say, and like therapy, but it's having a good time and just connecting with people. So I think that's really important to know for other interns that are looking for perhaps a more traditional setting.
During COVID, it has been a little bit more flexible, but in usually we are meeting once a week, and everybody goes through whether they need 1 or 2 hours, and then we try to do groups. Normally we do groups if you have a larger intern cohort. But really I'm allowing interns to check with me personally, the supervisor, if it's myself or somebody else. And so we arrange sometimes hours on a week by week basis. Schedules have really changed during this COVID phase quite a bit. But in general, we have like a more fixed schedule of hours that we would follow. But the intern would really set it up with the supervisor. So that's kind of the way it works. Have all kinds of training. So we work quite a bit on from a phenomenological or more direct experience point of view. So we will have discussions about that. We will have ideally weekly trainings that talk about what are the different models of working with elders, especially around forgetfulness or dementia care. So we do readings, talk about those for for whatever comes up for interns. But in general, we would say it's a kind of a weekly meeting connected with with group supervision, where we would do some trainings either pre or post the supervision.
There's opportunity there's meetings that are like sort of obviously required by supervision to meet with Dr. Nader one-on-one, but then there's the group where we were sitting with other interns as well as other care staff, learning not just sort of traditional therapeutic, but like what's needed in that setting. And then also there's opportunity for other meetings to sort of sit in with staff and also with the nurses, and like we get to learn about, this is the first time that I've really got to hear about prescriptions and like the effects and what's going on, who's taking what. And so they go room by room and like talk about each person individually. So there's the broader, but then there's sort of the more micro and who's being affected and how, and like what we can do to support them. So I'd say any opportunity that any intern wants with learning how a particular facility, like dementia facilities, run, all the way through to like working with dementia and forgetfulness. Like all of those things can be learned at the elder ashram. So kind of like what Dr. Notter said, however much the intern wants to learn, it's all there and it's all available.
The openness and willingness of the trainee intern to learn, to uh, really also do some self-introspection, look at really what gets all triggered, because we are dealing with many, people die here, right? There's a whole hospice that we also work with, and there's frailty. Not everybody's all that comfortable to look at an 80, 90, 100-year-old face and or body. There's the whole, this is you in the future. And the various stages of forgetfulness is, that the short-term memory loss or even other longer-term memory loss is not always easy for everyone to cope with. There's also, I think Celeste and I, we just talked earlier about some people really wanting to have, wanting to leave, or they have a sense that where's their family, where's their home. So that also is sometimes not easy to take, right? How would it be when I'm not at home anymore, when I'm not with my partner or my family? So a lot can get stirred within the student.
Mm-hmm.
So that to work on that and bring that forth and do some self-searching, soul searching, is probably an important part of this trainee or this internship, don't you think, Celeste?
Yeah, absolutely.
Yeah.
Being comfortable with um, older people is paramount, and that is their bodies and how their bodies function. So in addition to that, because it's so many of them have dementia and forgetfulness, I think as a trainee, being comfortable with what is, because there's not always like sort of a straight storyline to follow. There's nothing to fix or cure, or and so I myself have learned just the power of presence, being present with what's inside of me, but then also what's being presented. And I think like this might sound kind of woo, but like the energetic, yeah, just the energetic sense of my body and their body, and like how the two of us are meeting, because so much is not necessarily said, but it's what this felt sense is so profound there. And I think I also being comfortable with um, um, death, yeah, and those that are coming towards the end of their life, and some of them are sort of going through their past, and so just sitting and sharing that space with them, and is really important. Yeah, yeah.
That's beautiful the way you say that, Celeste, because it makes me also think of the having to face the fragility of life.
Oh, yeah.
You have some residents who are, they had a stroke, for example, they live here as well, and so their life that was just on that normal, quote unquote, normal path suddenly comes to an abrupt end, and something else comes up. So to be okay with that, and to be, as Celeste says so nicely, present with all that. And so it's really a movement away from just cognitive awareness, and I want to find out what happened, what is wrong, and how can I fix it, to much more of a being in your body and being present, being comfortable with silence. So silence is an important part of learning to just really be with another person, which is not about doing as much. What can I say? How should I say it? What clever intervention am I going to use? But rather to allow the client the freedom and process to look deeply inside of him or herself. And then that extra ability to be patient with the process is really something that I believe is a very valuable skill to learn that's applicable for all therapy throughout the next however many decades one wants to practice.
Hmm. I think too, if I may add one more thing, just thinking about, you mentioned like someone with stroke. And so as a trainee, I've had to become really comfortable with powerlessness, viewing powerlessness in another and their frustration that comes up with that. And yeah, and just sort of being present and compassionate and empathetic, but not creating a movement, just being. And it's really hard. And it's really human. And it's so important to work at the ashram and be able to handle that. To have people that have had a full life of agency and now they're not able necessarily to do what they used to do. It's really frustrating. So having to work with that in my own body and then also with them is tremendous.
I mean, I think, I don't want to be flip about it, but facing themselves is probably the biggest challenge. To look at yourself, to look at I talk about myself, how I think life should be, and then find out that life isn't quite the way that I like it to be. Or I am not who I think I am. I am also all these other things. Yeah, so looking in the mirror is not always the easiest thing to do. Yeah.
Yes, and sort of a more practical thing that I didn't necessarily expect to come up, but I remember in class, oftentimes I would hear professors talk about not revealing too much, or being careful of how I engaged with clients. And in this particular setting, I think a lot of those gray places come up in sometimes touch, or self-revealing things about my own life, or small gifts of like appreciation. Those are things that I was really scared and kind of nervous about from hearing my professors, and then again coming to a place where people live and our feelings are facing so much. I feel like that is, I don't know, that those rules don't necessarily apply, right? Because these aren't people coming to my office for 50 minutes once a week. These are people that are like facing the end of their life. And so, yeah, those gray areas I think are touched on a little bit more. And I wasn't aware of that. So I'm learning little by little, like my own boundaries with that. While obviously staying in like ethical boundaries, but just like where my comfort is with touch and how close I am with clients, and what I accept and also what I give to them in those ways.
The whole attitude that I would really have people consider is that elders are our teachers. So really, like, clients are our teachers. So to, that attitudinal shift away from I'm going to have to give to really feel open to having elders really help you to become a more full human being. I think that's something that is, I think, a big gift. What do you think, Celeste?
Yeah, absolutely. I was fortunate enough to come to the ashram with that sort of idea, just because of my own personal history and like loving that stage of life, or appreciating it rather. But yeah, absolutely spending time with these people. And it's almost weird to call them like elders and put them in a box of like demographic. Like they're just people, and they have all the same feelings and experiences and loves and hates and scares that we all do. And I'm like feeling teary. I like love them so much. And yeah, they're beautiful teachers. And I think in part what they're teaching me the most is presence, and like what it really means to show up for your life and to show up for the people that are in your life. Because it's so temporary, it's so fleeting. That's all I have.